women who have diabetes, when should they be delivered? First, understand there's type 1 diabetes, type 2 diabetes, and gestational diabetes. Most women that are diabetic in a pregnancy were not diabetic before the pregnancy. They have gestational diabetes, and it was discovered in the pregnancy because we screened for it at about 26 weeks with the sugar challenge. And then if they're recognized as having high sugars, they're put on a diet. And if the diet is successful, that is enough. And if not, they may need some insulin to control their blood sugars. The most mild category of diabetes is gestational diabetes, diet controlled. Those women do not need to be induced or delivered early. They can go to 41 weeks or whatever it is that practitioner normally lets his patients go to, because as far as the baby's concerned, they don't have diabetes because their blood sugars are normal. And even though they're having to deal with not eating this or that and it's a pain in the neck, the baby doesn't care. Baby's happy, not too big, not unhappy, no high blood sugars. Treat that baby and that pregnancy like any other pregnancy. Once a woman has gestational diabetes and she needs insulin, we don't want her to go past her due date. We find that when going past the due date has certain risks associated, and having diabetes has a risk associated. And when you put the two together, they're not just additive, they're almost, you can multiply them. I mean, the risk goes much higher when you have these two separate factors working against you. So you get to your due date and you get delivered, or just a little before the due date, at least until about 39 weeks. If a woman has type 1 diabetes, that is a major medical high-risk situation, and then she's monitored very closely throughout the pregnancy. The baby might be growing too large, it might be growing too small. Generally, you want, if the sugars are controlled and everything is controlled, you want to get the patient to 39 weeks and delivered. But if the numbers are not controlled, if the fluid is too high, the baby's too big, not growing well, very likely you need to be delivered even as early as 37 weeks. And in extreme situations, earlier than that. I hope this is helpful. Post your comments on your experience with gestational diabetes or diabetes in general. Until next time.